All right. We have started recording. So again, good morning, everyone. This is Phil Pugh. Um, we're going to go ahead and get started with our monthly coalition meeting. So if you're logged on via Teams or calling in by phone, just make sure you mute your phone, and we will. And if you need to talk, unmute. That way, we have clear communication going forward. Pretty static agenda. We'll knock this out as quick as we can. We'll first start off by taking a quick look at the COVID census and what it looks like today. I mean, we've been up the hill, made it all the way down the hill, and are starting to ascend again and hitting highs that we hadn't seen in since I would say August of last year. So just about this time last year, we were in the 100s area. So I'm looking at that curve. We're talking about right around here. We were in the 100s area. So obviously a bit concerning. I'm glad that we are getting vaccines and arms still, but nonetheless, the numbers are going up across both sides of the river. So while it's not hitting as high up in the northern area of the state yet, it is traveling that way. So regions 3, 4, and 5, so Springfield, Edwardsville, Marion region, and 6, Champaign region, are elevated in the state. Um, and that continues to move north. As you already know, and I'm sure Beth will probably touch on this a little bit. The Delta variant is moving very quickly, very rapidly. So we want to make sure that we stay ahead of the game this time. I will move forward. I'm not going to go over the deaths numbers. I will update this slide when I send out. I'm sorry, I couldn't get these out this morning, but I will send out an updated slide with the patient expirations numbers on here for the month of July. They are a little more than June's, and I think they may be a little higher than May's. But we'll have to take a look at that. So you should get a copy of that after the call. Our regional census, as we look right now, or excuse me, just our positivity rates, not our census, we are at 10%. We are at, the highest was 10.1%, I believe, which was a few days ago, maybe even 10.3%. I have to go back and look, but we've been holding 10% for the past couple of days, and that will be updated this afternoon. Hopefully, that goes down a little bit, but my Spidey senses are telling me that that's going to go up a little bit, looking at the way the numbers look. Um, ICU bed availability was touch and go there for a while, floating around that 20% mark, but we're back up to 28%. And the vaccine data that you can see there, we made a overall 1.6% increase in vaccines over the last month. So not a ton, but progress nonetheless. The last update I got from the state, and Greg, when or Beth, when it's your guys go, last update I got from the state last week was that around every 7 days, um, what's the right number? We're at around 700,000 every 7 days or somewhere around there. Um, but we're not making those large gains down here in our region or in the Marion region for that matter. So like to have obviously more vaccines and arms, but as they say, it is what it is. All right. All right. Any question on any of the COVID data? Nope. Okay. Well, we will start with Greg this morning, IDPH.
Good morning, everybody. Um, I don't have a whole lot to talk about. I'm going to talk from the hospital perspective here. Going to talk about EM resource again. So I want everybody to realize that we, meaning me, Beth, and Springfield, are looking at the EM resource numbers every single day as we go through this. And this continues to be very important that these numbers are accurate and updated in a timely manner. I know we did have a drill yesterday, and a couple of our hospitals didn't even respond to that drill. And as you guys are the HPP coordinators, the disaster contacts, the emergency preparedness people at your hospitals, you really need to have contact with whoever is responsible for EM Resource. Make sure they're very aware of how important this information is, and keep in touch with them, and have a relationship with them. Because I will tell you, if something happens, we are going to be reaching out, meaning me and IDPH are going to be reaching out directly to you. Most of us don't know your ED directors. I know most of the ED managers, but I'm going to reach out to you first if things go on. So please make sure you're aware of who's doing that and you share that information back down from this meeting. I want to add one other thing so it's very clear to everybody. Bypass has not been allowed since sometime in 2020. So make sure that your ED managers, directors are aware that they are not allowed to go on bypass at this time, as long as the emergency declaration is still in place. If things get really, really, really bad, you can reach out to us and we can work with you, but there is no bypass allowed at this time. So make sure that they are aware of that at your hospitals. We also have a status of peak census. Want to remind everybody, if you get to that point, and the definition of peak census is what your hospital sets that at. I mean, the trigger point of what peak census is, and the state will be responding to you to make sure that your peak census policies that are in place, that are required to be in place by the EMS Act, have been activated and started. So just kind of giving you this information if some of you weren't aware of that, but you are going to be, one of the point people that we're going to be reaching out to. So just familiarize yourself with that at your own facility and get in touch with the EM Resource people, so that you're relaying some of this information that we're sharing during this meeting back with you. And I did look at numbers today, and it looks like quite a number of our hospitals are very busy. And that's all I have to cover on that. So
Thanks, Greg. And I will follow up to which two of the items that you did bring up. One, yes, EM Resource. It's vitally important. I mean, I think we do I think we do an above average job here in the region at making sure we have our daily updates. But when it comes to crunch time and there is an important announcement that may be made through EM Resource, I'm not sure that everyone gets that announcement. And a lot of that has to do with your own personal notification preference settings within EM Resource. For instance, one of the, we had an organization or hospital that updated their ED status to be on bypass. So if you were just looking at EM Resource, you would have saw that, but you would have not got a notification if your notifications were not set up appropriately. So because and this was crazy because I thought I was getting every notification from EM Resource and I didn't get it. But me and Greg had a conversation and he was like, you probably need to check your notifications. And by golly, I did not have the proper notifications set up just to receive that specific alert, because you can set a ton of different alerts within EM Resource and how you prefer to receive them. So what I'll try to do is put together just like a 1 or 2 pager to send out as via email. But just if we took a quick look here in the preferences within EM Resource, if you go in here, which is preferences, and hit event notification, it'll bring up all of these different types of instances that are there and how you want to be notified. So you can pick how you want to be notified. But there that's where I thought I had everything correct. But this second one here, where it says status change preferences, if you go in here, you can in turn select the hospitals in which you want to know what information. And as you can see right here, I've gone through and reset all of these to make sure I receive all bypass alerts, peak census alerts, etc. So I'm made fully aware when an organization does update that and when it does change. So I'm going to get all. I won't miss any of those notifications going forward. So I put myself out there to say, hey, I don't do it
Melissa, it's
perfectly
Rachel.
either.
How are you?
So I would ask that each one of you
Good,
take
good.
an
Hey, is
opportunity
Meredith over there
to
today?
review.
Has
I think
she
somebody's
been
not on
tested
mute.
yet for COVID?
Hold on. I think we got someone who isn't on mute. If you
Oh,
could.
okay. Fantastic. All righty. Perfect. So if she's done, we can open back up. I will call and let. Okay.
I'm not sure who
Perfect.
that is.
Thank you so much. 5106. Thanks, ma'am. Bye-bye.
Apologies, team. Whomever that was, I'm sorry, but you weren't on mute. And that whole conversation was public and recorded, just so you know. Again, this is where you want to update those status changes within EM Resource. So I didn't get that notification, and so it took me by surprise. And I'm sure the organization that did make that change thought that someone would see it. Luckily, Greg did see it, but I did not see it. So please update your system preferences. And with regard to the actual drills that we conduct. Every year, we conduct 6 no notice MCI or EM resource related drills. Some days we have pretty good success. Some days we have not so good success. Yesterday's was a bit of a surprise to us as well. So it probably shouldn't have went out at the time it went out because it went out around the 10 o'clock time. We're going to redo that one, and then we'll have 5 more that go along throughout the year. So we will double back on that one, and it will be an MCI. I'll let you know. It will be an MCI notification. I won't tell you when, but it will be soon. So please ensure that your teams are ready. Whoever your EM resource points of contact, if that's someone in the ED, if that's you specifically, make sure your notification preferences are set up or it's up and visible in your ED so they can get that notification and make sure that they're able to update their red, yellows, and greens of how many they can accept. So any questions on EM resource? Nope. Okay, great. I'll minimize this. And Greg, did you have anything else?
No, I just do want to point out one thing for the advantage of setting the notifications, especially for hospitals that are near you. If they were to go on bypass, if the state granted them permission to go on bypass or they go to peak census, that's valuable information for your facility to know that the closest hospital or the 2 or 3 closest hospitals to you are getting a little overwhelmed, and you can expect that to be rolling your way. So it really is important to have that notification.
Absolutely. And thanks, Greg, for the good reminder. All right, we'll go and move on. For our health departments, Beth, I think I saw you on. Any updates today?
Yes, good morning. Can somebody hear me?
Yep, we got you loud and clear.
Great. So I think I'm not going to tell anybody anything new. The numbers are definitely rising. We are at 10% as of yesterday. They haven't updated the numbers yet today. 10% positivity rate in the region, in the Edwardsville region. And I think Springfield's a little bit lower, but the numbers are definitely rising. The health departments are busy, of course, with vaccination. Right now, the majority of them are working on getting the school-age children vaccinated. I know several are doing special clinics. They're doing vaccination clinics at the schools. So there's a lot of vaccination going on with those 12 and over. So glad to see that. Health departments are busy finishing out the fiscal year 21 grants and starting the fiscal year 22 grants. It's that transition time right now. And the other thing I wanted to mention was to not forget, especially the private sector partners, the hospitals, in that group, that OSHA came out with a emergency temporary standard. And if you have not read it, you can read it on the OSHA site. And there's also some FAQ documents, some guidance documents that you may want to take a look at that if you haven't already. And the last thing I wanted to mention was a couple of health departments asked me about viewing the hospital information in EM Resource. And just to remind you, if you log into WebEOC, there is a board on the left. You have to scroll down a little bit, but it gives you view only rights, so you can see what those the EM Resource numbers are for that particular day. And that's all I had right now, unless someone has some questions.
Thanks, Beth. Any questions for Beth? Nope. Okay. Well, I do have one question, Beth. With the Delta variants change and the amount of spread, how much data are you guys collecting? Is the state collecting that can be shared that shows, whether the difference in Delta versus the standard variant and breakthrough cases? Are you guys tracking both of those data points?
I believe that a lot of that detail is being done at the federal level. I know CDC has done a lot of research and data on the different variants. I will say that the vast majority of cases right now are the Delta variant. The statistics, and this is off the top of my head, so don't hold me to it, that for the Delta variant, the vast majority of breakthrough cases, so that's cases of people who have been fully vaccinated, if they contract the disease again, it's great majority of it is the Delta. Of those, a lot of them are asymptomatic or mild symptoms, and so they can contract the disease and spread the disease, communicate it to other people, and not even know it because their symptoms are low or not at all. So that's why the CDC came out with the mask mandate, was to avoid that transmission of people who are vaccinated may contract the Delta variant and not know it and spread it to other people. I think most of the health departments all know that. Hopefully you guys all know that too, but I've said it so many times to so many people. So that's the reason for the mask mandate. What was your other question? So.
Well, again, just the amount. I guess you answered that, being that the larger amount was the Delta variant, at least right now. Well, it's not specific, but I think the point was taken. The other question was just the amount of breakthrough cases, and I think you quasi have kind of answered that, but I didn't know if there was, just any hard data that folks could look at so they can have a, better understanding of what's going on out there. That's all.
Right. So again, nationally, if you remember the vaccine, when it first came out, they said it was 95% efficacy So that means that if you give the vaccine to 100 people, 95 of them will not get the disease. 5 of them you expect will get the disease. They're still trying to work on those final numbers to see if it's different for the first variant as opposed to the Delta variant. And that's hard to track because a lot of people who are vaccinated and do get a breakthrough case don't get tested, don't even know that they have it. But we probably, at least for right now, won't get a really hard number on that for that reason.
Indeed, not a problem, and great information to share there. And looking, I guess, my own curiosity over the past couple of weeks, just understanding that, when people say that it's, much more communicable, it's easily transmissible between folks, and they say 2.5 times, but folks don't, normally have a good visual on what that looks like. And when you see that it has like an R naught value of like between 5 and 8, at its best transmissibility, worse for us, one person gets it, 8 people get it. And to have that understanding, and also understanding that the viral load of the Delta variant is basically 10 times that of the standard variant, are, all good reasons for us as healthcare professionals to ensure that, one, we're leading by example when we can, and secondly, that we're able to at least talk to those about it, with regard to the vaccine's efficacy, to what you were just saying, and how easy it is transmitted between folks. Because I've had some conversations again over the past couple of weeks where folks, once they kind of had their aha moment, it looks like their stance has changed on vaccine. And that's just a few people in my circle. So I'm hoping that, if we can maintain, if we're all doing that, we're all paying a little bit forward, hopefully more people continue to get vaccinated, and in turn push the virus down, and one day we'll get to some form of normal. So thank you, Beth, again, for all the information. And if you have anything you need me to share out to the community, just by all means, let me know, and I will push it out.
Sounds good.
All right.
Thanks, Bill.
No problem. All right. Toss over to Dale. Dale, I see you're on. How are you this morning? Good folks at Stars.
Well, doing well. Busy like y'all are. I think same information really. It's we're seeing increases across the board. The metro region, most of you can see, some of you probably pay attention to the pandemic task force, which includes some of those Illinois hospitals, but it's primarily just that metro core. We're well into the upper 400s with hospitalizations. Yesterday, they did add, thankfully, they did add some information around pediatrics yesterday in their briefing. We typically, over the last several weeks, have had anywhere between about 10 to 15 pediatric patients, ranging from literally everything from 2 weeks to 18 years old, in our 2 primary pediatric hospitals, with 1 or more in NICUs pretty regularly. All of Region C, which goes on up to Pike County, includes Lincoln County, and makes its way down to, does not include St. Francis, does not include St. Genevieve or Perry County along the river there, but it does include St. Francis and Washington and things like that. We're into the 600s on hospitalizations. Obviously, those more rural hospitals add a little bit, but they try to transfer up our direction as much as possible. The statewide for Missouri, we're seeing significant increases. Seems like Southwest down in Branson, Springfield area is starting to slow down a little bit, but they're still projected to go up for about another 7 to 10 days. and they're in the neighborhood of about just over 600 hospitalizations there. Kansas City continues to see an increase, and tries to do a whole lot of transferring out, and folks are going to Denver, folks are coming to St. Louis. They're having a real struggle over in the Kansas City metro area with people hospitalizations right now. So we've been watching it, this eastward trend. We'll continue it. We're looking at so far what projections we're hearing is that we're about 6 weeks behind Southwest, although our incline looks the same. Our peak will probably be about 6 weeks after them. So, if we kind of do that math, then we're probably somewhere near the 7 to 8 weeks out of peaking. And so who knows where that number is going to go? Anywhere between what we saw back in January, which was well over 1,000 beds full, to somewhere even exceeding that, maybe. We don't know. We have had recently this week, we did have a conversation with State of Missouri DHSS as well as the feds regarding a possibility of an alternative care site in the St. Louis metro area and or monoclonal antibody site. Southwest region has instituted that as a joint effort down there. Those were conversations, not necessarily something we're immediately pursuing, recognizing the time that it does take to put it up. The ACS we had back last year was underutilized, and there's a whole lot of reasons for that. But we're trying to identify whether it would be utilized appropriately or not this time around in the appropriate time frame. So there's some hoops there. DHSS and the feds have also created some additional, I'm not going to call them barriers. It's protections for them and for the hospitals, I understand. But it does complicate things a little bit. So I'm trying to work through what that ultimately looks like. So that's, so if you hear those rumors, I just wanted to let you know that, at this point, there's not forward progress. It's a lot of generalized conversations. So other than that, I think that's about where we stand. There continues to be 2 EMS strike teams out of Arkansas down in the southwest part of Missouri for long haul transports. Those 2, I believe, end this weekend. But my understanding is that there are an additional 2 teams coming in to replace them, and from the Southwest. But that request is built in such a way that they can move them throughout the state to support, St. Louis if necessary or whatever. So that's the update from our side. Any questions?
I appreciate that, Dale. We did reach out to IEMA here, and our folks at IDPH with regard to what we did last year regarding McCormick Place and our other ACS facility that went up here in the state when we were, preparing for the surge, et cetera. They have basically volunteered any lessons learned or expertise to share with your team if you're going to continue those conversations again. So just a little, cross-state support if and when needed. So you just let me know whenever, you or Brad, just let me know whenever that starts to shift again. And we've got points of contact for your team to help. And we'll definitely support as usual, here in the Edwardsville region.
Certainly appreciate that.
All right. If Mike's on, I'm not sure if Mike's on. I know he's here. Mike, are you on? Anything from Remert? I hear him in a conversation on the other side. So
sorry, I was on another phone call, Phil. Sorry.
Yep, I'm about to say I could hear you. I was going to make a note, but go ahead. Thanks, Mike.
So Remert's we're doing training, working on some new equipment that's coming in and getting trained up on the new equipment. From there, we're just kind of moving forward with building our skills up and our ability to support the region.
Did you want let everybody know about? Well, I'll just say it. I know we got the other, or we're putting or placed another order for our female trauma mannequin. So that's going on this forward, and our Remert team really uses these a lot. But one thing I will say is that while Remert uses them a lot, they're for the entire coalition. So if you want to set up any training and test your EDs on some trauma cases with that mannequin, so use some of that TNCC knowledge or whatever. We're going to have 2 fully functional mannequins that are they medium fidelity, Mike? How?
They're medium fidelity. And Phil, while it looks like we're using them a lot, we're using them with other agencies. We're just running the mannequins while other agencies are doing the training. We're doing a lot of outreach with them, and other agencies are using them a ton. Our use of them is just really running the mannequin so that they have someone that knows how to use the mannequin run them.
Exactly. So they're the guys controlling the sounds, the pulse, the blood squirting out. So and you guys can have your team just kind of run through scenarios. So again, another great resource. We got some good folks trained up, and if you need it, please reach out. Thanks again, Mike. I don't know if Sue is on. Sue, are you on? Trying to look through the list of folks. I don't see, I know Dana's not on. I don't see Sue, so we'll skip over the mental health team. Well, before I skip over the mental health team, we're going to be talking AAR stuff here shortly, and COVID AAR. And I would say I've been crunching the numbers to be prepped for the upcoming meeting and the results from the initial survey. And one of the top 3 things that was requested for training was mental health training and or support. So I know it's been a long, year and a half fighting COVID. As we continue to do this, and a lot of folks are still stressed out there, we have those resources available as usual. And I sent it out about 3 months ago, the last time, those flyers, but those are still serviceable. And I hear the requests. So if we're talking mental health team, if you're one of the folks to put that in as a request, or things that you see you need in the immediate future or over time, over the the next 3 to 5 years as well, start to put in your your thinking caps what type of mental health support and how we can make it a little more robust here. We do have Mike, I didn't get it on the slide, but I'll try to put it in before I send it out. But we do have some mental health, or the critical incident stress management team training. Is that in September, Mike? I gave him 5 minutes.
Sorry, Phil, what was that question?
There you go. The CISM training.
The CISM training we are waiting for the contract to come through, and it will be held November 15th, 16th, and 17th, and it will be a virtual class.
Okay, so that's coming up, and we want to knock that out the park. So
that's for 20 people.
Great. So we hear the need. We're trying to put on as what we can now, but if we're going to start looking out in the future, we want to make sure that we are garnering that level of support from you guys and letting us know what you need, and we'll try to make it happen. All right. Any pediatric updates for Eric?
Yeah, just a couple, Phil. The HSHS, it's Brad Gadding. He runs a kind of like a regional pediatric group that gets together and talks about changes to policies and procedures. That's 12 August. So, one of the things that we're supposed to do under this current grant is to try to advocate for more EDAP and CDAP hospitals that would take on those additional roles of pediatrics. So if some of the hospital systems are interested that are not those, trying to get on this call, figuring out what's going on, because as we get policies and changes coming from the state, it kind of helps, determine what you need to do to get on board to kind of get those systems in place. The other thing is the week of August, excuse me, here, the 25th through the 26th, we're running our pediatric disaster preparedness and response class. That's a FEMA class. That's MGT 439 at Southwestern Illinois College. So there are folks out there that want to get, spruced up on their ability to respond to pediatric issues. We got that class set up as well. That's all I got.
And that class, another great class, I think they just ran one or about to run one soon across the river as well. So really good class. I think we have just enough to make sure that the class goes on, but we still have room for more. We'll make sure that we're all social distanced and meet all the requirements for the folks out at SWIC. But definitely, that one is a face-to-face. So hopefully it still continues on. Hopefully we can manage what we have right now as far as our COVID going on right now. So thanks, Eric. All right.
So Phil, this is Dale. Are you still
Yes.
needing peeps in that one?
Lee,
in your offering?
I'll toss over to Lee. What's the current status? How much more room do we have for that?
We've probably got room for another 10 or so, maybe 12 at the most. We met the minimum. The minimum was 26. We're over 26, but I think we can handle about 35 in the room.
Okay. I wanted to make sure y'all guys had enough people, we'll certainly continue to push, but I wanted to make sure if we needed to push more, because our date is September 30 to October 1st. So, so I wanted to make sure y'all had enough in yours too. So.
Well, we appreciate
Thank you.
that. We'll definitely stay in direct contact. And if we can push out, we definitely would support, obviously, our partners in St. Louis to attend that course. Okay. General grant status update. Few things. First, Christina Hendon Atkins, who was, who has been working grants for the past 2 years and change, 2.5 years, maybe even 3, maybe 2.5 years. She's been great for us. She has resigned from her position. She's moving on to a new position outside of BJC. So outside of the BJC family. So she's moving on, and that official transition, her last day is on the 6th, which is Friday. So 2 weeks ago, about 2 weeks ago, she let me know. We just had a meeting yesterday covering, all the current grant status issues and going through our transition. Good news is we will be Sarah Frederick, who started off working with us when we first merged with BJC. She's returning to it. So she's highly familiar with everything and all the processes. Take her a little bit to get really back into the swing of things. But she will be at least interim. I don't know if that's going to be something permanent for her because she had moved positions, obviously moved up to a higher position actually over there in the grants management. So, but she'll be coming over. So hopefully we won't see that big of a deal when it comes to communication and making sure we have those sub awards. Okay. Knocked out properly. And speaking of that, I encourage everyone. I know we just got somebody just sent in their invoices yesterday. Spend your money. You got till October 31st on this NCE, this FY21 no cost extension. So for those of you who had a sub award, you have till October 31st. While the grant does go out through January 31st of 2022, October 31st is your deadline. That way we have enough time to reallocate any funds and get that executed. As for the FY20 NCE that just ended on 30 June, Christina and the folks at GMO just completed their submissions for all the reimbursements there. We spent 99.9% of those funds. We had about $900 left over. So great work for the folks that spent their funds. And my team here did a great job. So we literally had only $900 left over from that. So putting that money to great use. So we want to do that going forward. With that said, and I'm not gonna try to belabor too much grant stuff today. And maybe we'll talk again in October very heavily with grant stuff. But I want just to relay a few things to you guys with regard to the grant funds, as they are now. They will continue to work. We will continue to work in primarily the same manner. But I will say this: I'm probably going to be a little more tight-fisted when it comes to some of the dollars going forward, in the outgoing years. And what I mean by that, and I'm not saying just me, I'm going to talk with the executive council folks, and we just need to have a discussion with how we are going about and spending funds every year in the outgoing years, and specifically on the stuff side, the equipment, supplies, materials type of things, really reprioritizing how we do that. We talked about this about a year and right before COVID, really. We really talked about this about a year and a half ago, the summer of 2019, and almost 2 years ago, about the need to purchase more and more stuff versus the execution and the use and maintenance of the stuff that we have, doing more teamwork oriented education, training, exercises versus bringing in more equipment, supplies, and materials. So I'm going to ask each of you guys who are listening now and who will listen later to start to recalibrate how you look at grant dollars. Try to look for ways to execute using grant funds in the execution of exercises, the execution, of training, and making our staff more prepared in our hospitals and in and around the community, prepared to deal with whatever the challenges are that we've outlined, through our HVA capabilities analysis, et cetera. So while I have no problem spending money on things, we've bought a lot of things over the last 5 years, a lot of things. And I've tried to make sure that that's being invested in things that are, I hate to use the word perishable, but things that don't have an expiration date on them all the time, because sometimes we just buy stuff and it just sits. And I want to get us to more of a footing where we are executing more than having stuff being equipped, and just really massaging and working into our plans, and how we're organized and trained. So just take that little bit of nugget with you. And then when we reconvene to talk about grant funds and what you want to spend on projects, try to have more of a operational slant to them. The second part of that is we talked on that in that same time frame 2 years ago about what's required when you receive grant funds. Right now, there are only 4 things that you have in your subaward that are required. 1, attend quarterly meetings. 2, participate in the HVA, participate in exercises as needed, and participate in reviewing plans. I'm going to, as we start to move forward, so as the next set of subawards, there will be maybe a slight change to those requirements that I'm going to add in there. And that's going to be, basically, I'm trying to set up a scale, and depending on the amount of funds you request, because we've had some pretty big projects get funded, folks over $20,000, upwards to $50,000 and $60,000, which again, I have no problem with doing or funding when we can. But with that, I'm going to ask you guys to step up on the level of responsibility and things that you contribute back into the coalition. And I'll just give an example. If you have a project and it's $50,000, right? Let's just say it's $50,000, but it's an important project, and I think it's worthy of, and the council thinks, yeah, I don't have any issue with that. I think it'll be great for the coalition, whatever that is. It could be a piece of equipment. It could be an exercise. It could be something that you are trying to, or training that you're trying to bring in. Maybe the ask will be, okay, if you want to do that at that level with that amount of money, you need to manage a portion of the deliverables as outlined in the notice of funding opportunity in which we look at each year. So a lot of times you hear we say grant deliverables. The 6 EM resource drills that we did that we're going to do over this year, things that we have to do in this year. Build a burn surge plan. We have to do this year. The ask may be that you will pick up one of those deliverables. That may be, you've got the burn surge plan. So coordinating the meetings and getting the plan draft completed and then taking that across the finish line versus just a static participate in HVA, doing those static things, doing something that's a little more manpower intensive, I would say, but speaks to the amount of funds that you are requesting. So keep that in mind. We're going to talk about it again later, but I want to at least, again, plant that seed now. So as to when we hear this again in October, or September, it's not new to some folks, and I would really, really appreciate your feedback. So not now necessarily, but if you want to shoot me an email or when we can talk about it later, we may even do like a mini workshop, 30 minutes to an hour, and just kind of discuss it openly as a coalition. So I appreciate that. I'm going to update.
Hey, Phil.
Oh, yes, go ahead.
I just wanted to add something on that. I think, that's a great idea to expect those who are getting dollars to, put a little more effort into it. But I did want to also remind that all hospitals under the EMS Act are required to participate in the grant activities, whether they take dollars or not. So that is in the administrative code and the rules. So just in case, and I don't think any of you would be this way or out there thinking, well, I'm not going to ask for anything, so I don't need to do that. You actually do, whether you get dollars or not, by the EMS Act. So just so you know that, and we are looking at that administrative code to update it because the coalitions are not directly written in there, but the addition is going to be participation with the coalition as part of that whole law that exists in Illinois. So just as an FYI to everybody that, even though you're getting dollars or not getting dollars, you do still are required to participate in disaster planning under those emergency grant portion of the EMS Act.
Thank you, Greg. Appreciate that. The COVID-19 response AAR. Thank you again, everyone who participated in that. It's been very difficult to parse the data. So I've taken all the data out of it and put in Excel spreadsheets. So it's been like really, really hard. But all that said, the actual workshop, and you should have seen this on one of the flyers that Lee has sent out a couple weeks ago as well, but is on tomorrow. It's the 5th. What time is it, Lee? What time is it? Is it in the afternoon? Is it 1 to 3?
Yeah, it's 1 to 3.
Okay, it's 1 to 3 tomorrow. It's in Member Planet. Please sign up, plan to attend. We need your participation in order for this to really have any effect. We want to get your feedback because we will have, the document itself will have, results, but we want to make sure that we're capturing the actual feedback that you have. So even if you didn't fill out the survey, I'm asking you to participate in the actual workshop, and we'll kind of just walk through all the answers, grab your feedback, and try to put together a document that that we can look back on and go, okay, this was good. And again, it's from a regional level, so it's not to talk about what you specifically did all the time within your hospital. And I'm sure you guys are doing your own or have done your own once or twice so far with regard to COVID. but it is to look at how we are working together as a coalition, how the RHCC performed during this time frame and supported the coalition, et cetera. So, and it also looks at your health departments and local emergency management agency as well. So we want that so we can have a better regional understanding of what we did good, what we did bad, and how we can make it better going forward. Again, it's in member plan. You can sign up now. But again, if you did not participate in the actual survey, it doesn't matter. Okay, we'll go over the survey results and then we will talk about it and garner that feedback. So. All right, patient decon training. I'm going to turn this one over to Lee, give him an opportunity to discuss patient decon training.
Yeah, thank you. Good morning, everybody. So we have 4 current decon courses that are on the roster for the next couple of months. All of these pretty much are travel courses, meaning that we're going to the end HSO as opposed to them coming here to Belleville. Looks like the way we've got it running right now, the first class we're going to have is actually out in Greene County at Boyd Hospital, and that's actually slated for September the 29th. There is still space available for, just so everyone is aware, for any travel course, we have to have a minimum of 10 people, 10 actual students who can dress out and go through the whole shebang in order for us to be able to do that, because we are actually bringing in outside partners from REMERT on their days off, or even in some instances getting their employer to cover them to come to help teach these courses. So it is resource intensive. In order to ensure we're getting the best bang for our buck, we just want to make sure that we have as many folks there as we can get. But again, Boyd is our first class back since the COVID nightmare began. So we will, dust off the old boots and get back at it. The class following that will actually be over here at St. Elizabeth's, and that's going to be on October the 6th. The October the 7th, so we're doing 2 classes back to back, just due to scheduling. The next class after that is in Fayette County. So if anyone's interested in driving out to Vandalia to either teach or take, please let us know. You can register on Member Planet. And then October the 15th, we have Gateway. So the problem we run into after about the middle of October is the outside environment starts to get a little cold to be doing wet decon training. It's not to say it can't be done. We've done it in the past, even into February up in Carlinville, but we do need to have a little better grasp on the facility and what the equipment is, because things freeze and get slick and things like that. So if you want to do a winter class, please let us know in advance so we can kind of work with you to make sure that it's feasible. If not, then if there is a need, we can always do classes here at Belleville. COVID permissions, as long as they don't change on us. We have the space for both the decon and the classroom. So we can always work that out if we have to. But beyond that, again, please make sure that your equipment is up to date, because your students, whether you're taking it at your HSO or sending someone to another HSO, you do need to make sure that they have PPE and that it is all serviceable. We do not bring PPE with us for those classes. That's the reason we gave everybody PPE, and it's all the same. That way, no matter where you go, you can use it. We will continue to do everything necessary as far as fit testing and such. We have the equipment available. You can sign it out. They're actually scheduled to be here tomorrow for, they just came back from their annual maintenance. So anytime after tomorrow, they're available. But beyond that, I think that's pretty much everything. If I've emailed you specifically, and I have sent some emails out this morning to some of the HSOs with classes, please make sure you check your email, and we'll continue on from there.
Thanks, Lee. Any questions for Lee? All right. Sounds like we got somebody unmuted. Let me get that. All right. So yes, please sign up for decon training. While we have the opportunity, even though I think it's a small window of opportunity, we want to take advantage of it. We understand that we have not been able to do this because of COVID, and thankfully we haven't had a major incident. So those are pluses. All right, open floor. Anybody have anything that they'd like to discuss, share, or need support with?
Hey, Phil, I like to put a plug in real quick for MyTup.
Oh, great. Go ahead.
Yeah, so right now for everyone, the tentative schedule for the next MyTap workshop is going to be the 15th of September. And what I would ask is that even if you're not the one that deals solely with training, but you have somebody that you do work with, whether, in your hospital or somebody that takes on that responsibility, please, once I send this thing out to member plan, just disseminate it out to everybody that can participate, because the training that we're looking at is the training that affects you the most. So if there's something out there that you really wanted, and of course 2020 didn't really help you get that on the calendar because we shut all the training off, and as we're trying to get the doors, turn the lights back on and get the doors open again, if there's something that you want, this is your opportunity to, tell us what kind of training that you are looking for based off of your needs. And if you got an individual that handles that for you, make sure that they attend the meeting so they can chime in, because if we don't hear anything from you for training or exercises that you're trying to run, then it kind of falls on deaf ears, and then we end up taking over in a way and just kind of put those together in your absence, and then you don't get a vote in the system. So just want to throw that out there. Thanks, Phil.
No, thank you, Eric. Yep, we're going to be hosting a training exercise planning workshop so we can basically put together the MyTap to look at, and as we build those, we're really looking at, 3 to 5 years of training. So we're really setting those themes. Last time we did is about 4 years ago, and it has served us fairly well, I think. But Eric is gonna kind of lead this going forward, and we'll try to just add it year by year, or basically set up something that we can wash, rinse, repeat, and then add small things as we see fit. But your input is what we really, really need. So we don't want to seem as though we're just saying, hey, we're just picking this, because we think it's cool. We want to make sure that we're meeting your needs as well. So, but we won't know that if you're silent. So please get involved. And I think that is in Member Planet as well. I don't know. I don't think it's built out yet, but that will be in there. So make sure that you sign up. And while I'm saying that, we are looking at moving away from Member Planet to a different site to do two things: host our public site and our membership site. It will be very similar to what we have now, but I think a little more user friendly. And we'll have a better event/calendar management system. So it will be a little more appealing to everyone to revisit and use over time. Member Planet has served us very well, but we are looking at alternatives to change over. So please, sign up and take a look at things that are in Member Planet now. Make sure that you're, aware of everything that goes on. We try to make sure your emails and everything are up to date inside of Member Planet. So that way, when we send out notifications, you are receiving them. Because I try not to, and we don't maintain individual distribution lists. It's 120 people in Member Planet, and trying to maintain that type of list would be daunting. So when and if you move positions, you can control your information flow and just, take your name out and unjoin. You can separate on your own time frame without us having to worry about it or miss you when you switch over. So, okay. Anyone, again, last chance, anyone have anything?
Hey, Phil.
Yes.
It's Greg.
Greg.
Two things real quick, hopefully. One, we had COVID-19 dollars, right? And did we spend those?
Yeah, so that was in part with those additional funds. It was like 200 and I don't know, it was 220 or $260,000 COVID. A lot of that went to the ventilators that we purchased, which we did just receive last week, Thursday. They came in.
No.
We got those.
I was just wondering if we had, because,
we did.
I get the spreadsheets, they're so late, and I'm
Yeah.
like, you're much further along than I get the information. So that's great. The other thing that I did want to say to everybody is that, in my role as the regional EMS coordinator, I wear two hats. One hat is to help you guys as much as I can and be a liaison with Phil and the coalition back up to the state for the hospital grants. But I unfortunately also have a regulatory hat I have to wear when it comes to EMS Act and administrative code. So I know I had to put that hat on a couple times today. I hope I wasn't offensive to anybody, reminding them what their responsibilities are, or to think that I don't know or the state doesn't know what a fantastic job you're doing. So I know I don't usually remind people what they have to do, but I did a couple times today. So I just want to let you also know that you guys are all doing a great job under a lot of pressure, being very busy. And I know Springfield appreciates everything you guys are doing.
Thanks, Greg. All right. With that said, we'll close it up here. Oh, before I forget, let me go ahead and show you the upcoming events. Next meeting is on the 5th, HVA workshop. We are going to briefly have the standard, we're probably going to cut it to about 20 minutes. So be prepared to just blow through your slides, but we're going to use the remaining time. That's our quarterly time, but we're going to use that time to conduct HVA workshop. There's a few things that we have some issues with regard to how we used to do the HVAs, and we want to make sure that we're pulling in enough folks to do those. In the past, it has been very hospital centric, and there's nothing wrong with it being hospital centric, but we want to make sure that we're getting folks in the fold that are throughout the community. But we're going to HVA workshop, so that's going to be our next. It's monthly, but it will be actually our quarterly meeting, which is normally set for 2 hours. So please bring your thinking caps. We'll send out some information for everyone. We're looking for max participation. There may be a small survey for each of you guys to kind of fill out that we'll consolidate the information with. So please be on the lookout for that. The COVID AAR, again, tomorrow, 1 to 1300 to 1500 tomorrow. The supply chain integrity assessment workshop, that's next week. Okay. Remember I talk about all these deliverables. These are things that we have to do. We get money from the federal government. This is what they're expecting us to do. So we'll be working that. That's next week. Those decon training dates are right there. And the locations in which they're being held. Hopefully I got that right, Lee. The pediatric disaster response preparedness course at end of the month. And then we've got a few other things on here that we don't have listed. Hence one of the reasons we are trying to move over to a new site that gives us better event management planning and calendars, etc. So be on the lookout for that. And the IAM 15th through the 22nd, that's in Grand Rapids, Michigan. I normally attend that. Myself and Lee normally attend that annually. I'm still on the fence about attending just due to COVID reasons. And the same thing with the National Healthcare Coalition Preparedness Conference, because it's being held in Florida. We're kind of on the fence with that. Are potentially looking at going down. I know Eric is, so we're looking at sending a couple folks here from our organization down to Anniston, Alabama, to the Center for Domestic Preparedness to attend the respiratory protection or respiratory protection managers course, or whatever the new title of it is. But that's later in the year. I think it's the exact same time frame, 30 November to 2 December. So if you're looking for something to attend, that may be something you'd like to attend. Anything at the Center for Domestic Preparedness is paid for with your tax dollars, so it doesn't cost you anything. Doesn't cost your organization anything except for the time away from work. So please be on the lookout for those. Last chance for anyone? Once, twice, thrice?
Bill,
Hey.
this is
Oh,
Rick
somebody.
at Gateway. Do we have that AAR meeting? Is that a call-in or an attending meeting?
It's a call-in, and the information should be in the the Member Planet invitation or whatever is there. It should have the information there. If not, just reach out to me or Lee, and we'll make sure you're squared away.
Okay, thank you very much.
No problem. Thanks, Rick. All right. Well, we'll end it here, and we will see you guys on the next one. See you next month on the 5th. Take care.